Bruxism is grinding or clenching your teeth. The latest thinking is it's probably two types of bruxism. One is as a result of sleep disordered breathing because it helps maintain a patent airway. The other thing that happens is going straight forward. This is more of a daytime phenomenon. This is how some people manage stress. So that's a difficult problem to really get under control. It's sometimes tooth grinding is just tooth grinding. I make lower bruxism guards all the time. The upper ones get in the way of the airway. You should have a lower one, regardless.